Hi, my name is Kim. I'm going to be going over the signs and symptoms for all types of hepatitis. For all types of hepatitis, the symptoms can be very similar, but I'll go over the slight differences depending on the type of hepatitis virus. Overall, the main symptoms for all types of hepatitis include the ones shown in the picture below. These are jaundice, dark urine, clay-colored stools, nausea, vomiting, loss of appetite, fatigue, and others are abdominal pain, fever, diarrhea, and joint pain. For hepatitis A, the symptoms can usually last less than 2 months, but children under 6 years old usually do not show any symptoms. Patients with hepatitis A are the most contagious when they are asymptomatic. This is in the late incubation period, and they are no longer contagious when they show signs of jaundice. For hepatitis B, we're going to have the same signs and symptoms. In hepatitis B, the symptoms begin to show in an average of 90 days after exposure. Symptoms can last several weeks or up to 6 months. Some acute hepatitis B infections can resolve on their own, but some are going to develop into a chronic infection. Most people with chronic hepatitis B are asymptomatic and have no evidence of the disease, but there are some people with chronic hepatitis B that will develop cirrhosis or hepatocellular carcinoma. In hepatitis C, when the infection is recently acquired, the patient can be asymptomatic or have mild symptoms. When symptoms do occur, they will present as the ones previously mentioned: the fever, fatigue, jaundice, and dark urine. Symptoms will begin to show around 2 to 12 weeks from exposure. Patients with chronic hepatitis C can be asymptomatic for years or have nonspecific symptoms, but many of them do develop chronic liver disease, which can cause cirrhosis and liver cancer. Hepatitis D. The symptoms for hepatitis D depend on whether it has occurred as a co-infection with hepatitis B or as a superinfection in a chronic hepatitis B carrier. Co-infection symptoms are usually limited to acute hepatitis. These include your nausea, lethargy, and abdominal pain. In a superinfection, it can result in liver cirrhosis, cancer, or liver failure. Hepatitis E. The symptoms in hepatitis E occur 40 days after exposure. The symptoms are the same ones as mentioned before. But it's important with hepatitis E to remember that pregnant women in the 3rd trimester are more likely to experience a severe hepatic illness.